So this week we're going to cover 2 chapters. We're continuing on with the skeletal system, and then chapter 8 will also cover joints. So we will go in depth of the 80 bones that make up the 3 regions of the axial skeleton. You've got the skull, the vertebral column, and the thoracic cage, and then the functions of the axial skeleton. Then we'll move on to identify form and function of the remaining 126 bones of the appendicular skeletal system. The next chapter, chapter 8, will cover joints. And it's important because understanding the nature of joints will help you treat patients with injuries. Now, I'm also going to give you a quick little tip of how to identify the differences between cervical, thoracic, and lumbar vertebra. The very first thing, if you have in lab and if you have to go through and identify the 3 different types, always find your cervical bones first because they're the easiest to identify. They're the only ones that are going to have, coming off the transverse process here, they're going to have a hole in the center, and that's your transverse foramen, and that's going to be for arteries and veins to go through. So I would pull out the cervical first. Then, if we need to look at our thoracic and lumbar, how to tell the difference. If they are loose, and you need to turn them the same way, always turn them to where this notch right here, and that's called your inferior notch. Turn them this direction so that it is facing inferior. Then you need to look at the spinous process on both of them. Look how long, and this points inferior, this spinous process on the thoracic. It's longer, it's pointier. If you look at the lumbar, look at the spinous process right here. Those point towards the posterior, towards the back, and they're more blunt looking. The body will be thicker and heavier based. And then another little trick too, when you line them up this way with the inferior notch facing this way, if you notice, this looks more like a giraffe, and the lumbar is always said to look more like a moose. I've got 2 videos to cover. One will cover skeletal, the other will cover joints, and that'll be a great introduction to both of these chapters.
All right, that's more like it. Like I said, we're going to learn all of the bones of the skeleton in this video. Mortimer's here, and we're ready to get started. Let's do it. All right, we're going to start from the top on the skull and work our way down through what we call the axial skeleton. And then we'll move to the arms and the legs, which we call the appendicular skeleton. And at the end of the video, we'll review all the bones again with Mortimer, and you can take a quick self-quiz to see what bones you've learned and what you still need to practice. Let's start with the skull at the top, which is removable here. Sorry, Mortimer. Whether 'tis nobler in the minds of... Yeah, I don't know what that line is. So here's the skull, of course, and it houses your brain. The main part of the skull here contains several bones that get sutured together whenever you're developing as a baby. You know how babies have a soft spot on their head? That's because a lot of this is cartilage, and then it fills in with bone over time as these bones grow together and form your adult skull. The parts of the skull also match the lobes of the cerebrum. So if you know those lobes, the names of these parts of the skull will sound very familiar to you. First off, we have the frontal bone, which is going to cover this frontal part. We have the parietal bones, which will be these bones right here on the top of your head. And we have the occipital bone around the back right here. On either side, we have what's called the temporal bone, like your temples. So again, those are the frontal bone, the parietal bones, the occipital bone, and then the temporal bones, one of which you have on each side. Like I said, the skull houses your brain, and you can see these kind of interesting shapes, and that's where the brain sits in there. And you see this big hole right here, which is where the brain connects to the spinal cord. Did you know you had a big spike in your head? In case you didn't know. That's not really there, that's just for the model, by the way. If you do have a large metal spike in your head, go to the doctor right now. Like seriously, call 911. 2 more parts of the skull. This part right here that's superior to your mouth is called the maxilla. And down here we have the mandible. Go ahead and take a moment and stretch your mandible out there. If you notice, the mandible is actually not really attached to the rest of the skull except by the joint in the jaw right there. So it's able to move freely from the rest of the skull. Much better. The next bone I want to talk about is the sternum. The sternum runs from here down to this tip at the bottom, and you can feel your own. There'll be a little notch in your neck right here, and that's going to be that indentation between these 2 bones and your sternum. And if you go down from there, down sort of in the center, you should feel at the bottom of your sternum, you can feel where it sort of like pokes down a little bit. That's going to be the bottom of the sternum right here. Now, branching out of your sternum are a bunch of pieces of cartilage. You see those pieces of cartilage right here. We call those the costal cartilage. and they connect your sternum to your ribs right here. As far as your ribs go, you've got 12 pairs of ribs. If I count in the front though, I won't count 12. I'll count 1, 2, 3, 4, 5, 6, 7, 8, sort of. So we can't really count them from the front. So I'm going to spin Mortimer around in the back so we can see all of those ribs. We can count the 12 pairs a little bit better from the back here. We've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 ribs. And there's 3 categories that we use for the ribs. We've got true ribs, false ribs, and floating ribs. Here's how you can tell the difference. The true ribs are going to connect from the vertebrae of the spine to the sternum, and there's going to be one piece of costal cartilage for each of the true ribs. So we have a true rib here, a true rib here, a true rib here, here, and here, for a total of 1, 2, 3, 4, 5 pairs of true ribs. The false ribs are where the rib connects to a piece of costal cartilage that joins with other costal cartilage here. So we've got 1, 2, 3, 4, 5 false ribs. And finally, we have 2 pairs of floating ribs. You can see the floating ribs actually don't connect in the front. They start with the vertebrae right here, and they just extend out, and then they sort of just float there. They don't connect in the front. So 1, 2 pairs of floating ribs. So 12 pairs of ribs total. We've got 5 true ribs, 5 false ribs, and 2 floating ribs in the back there. Now, connecting the skull to the ribs, of course, are the vertebrae of your spine. And we categorize the different vertebrae depending on where they are and what they attach to. And if you know the names of the spinal nerves, these terms will sound very familiar to you. So in the most superior part, we have 8 cervical vertebrae. We have 12 thoracic vertebrae, and the thoracic vertebrae are called thoracic vertebrae because they connect to the ribs. That's why we have 12 of those in that category. So 8 cervical vertebrae, 12 thoracic vertebrae. Then we have 5 lumbar vertebrae down here. And then we have this bone called the sacrum, which has multiple nerves that extend out of it. And finally, the tailbone, which is called the coccyx. So 8 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and then the sacrum and the coccyx. Now, all the bones that we've talked about so far, the skull, the vertebrae, and the ribs, are all about protection. The skull, of course, protects your brain. The vertebrae protect your spinal cord. Your spinal cord runs down through the middle of all those vertebrae. And the ribs, of course, protect your heart and your lungs. Also, all the bones that we've learned so far are part of the axial skeleton. The axial skeleton is everything kind of down the middle. We've got the skull, the maxillomandible, the sternum, the ribs, the vertebrae, and the sacrum and coccyx. That's all part of the axial skeleton. Everything else that I draw on the diagram, all in blue, is going to be part of the appendicular skeleton. Appendicular, the same as appendage, means things that are sticking out. And so your arms and your legs sort of stick out from the main part of your torso, which is why they get the name appendicular. We'll start with the shoulder and the arms. These 2 bones right here are your collarbones, or clavicles. You can feel your clavicle if you feel right there on your neck. And those will connect from the sternum to your shoulder blades, which is called your scapula. Your scapulas are posterior to your ribs, or behind your ribs, and they sort of slide around. If you can feel your scapula, you can feel it sliding around if you move your shoulders like this. If you move your shoulders like this. If you move your shoulders like this. And your scapula and your clavicle, which combined are known as the pectoral girdle, are going to form a joint with this bone, the humerus. Your humerus, of course, is also known as your funny bone. So this is your shoulder joint, clavicle, scapula, and the humerus. If we follow the humerus from the proximal end down to the distal end, it's going to connect at your elbow joint to 2 bones called the radius and the ulna. Of these 2 bones in the forearm, the way to tell which is to find the one that's on your thumb side. On your thumb side is going to be the radius. And I think of it like this. I take my thumb and I move it in a circle. Well, circles have a radius. The bone on the pinky side is called the ulna, which is kind of a tiny little word like your tiny little pinky. Oh, the cute little ulna. The reason I like to use the thumb and the pinky to remember which is because these bones actually move across each other whenever you turn your wrist like this. Watch as the radius goes back and forth over the ulna as Mortimer moves his wrist. Which brings us to the bones in the hand. The wrist bones right here are called the carpals, and you've got a bunch of them. You can see lots of tiny little bones there. Those are the carpals. You can find those there in your wrist. Just distal to the wrist are the metacarpals. And these are the bones of the hand. So your metacarpals are these bones right across here. So carpals, metacarpals. The bones in your fingers are called phalanges. High five. Yeah, we're tight like that. And one single phalanges bone is not a phalange, it's called a phalanx. So one phalanx or a bunch of phalanges. So those are the bones of the arm. We've got the clavicle, the scapular or shoulder blade in the back there. We've got the humerus. Here we have the radius on the thumb side, the ulna on the pinky side. We have the carpals, the metacarpals, and the phalanges. All right, let's move down to the bones of the leg, and we'll start with what we call the pelvic girdle. The pelvic girdle is made of the pelvis, which we see right here, and that connects directly to the sacrum back in there. Now on Mortimer, you see all of the white, which is the bone, but you see this yellowish color here as well, and you see it between the two halves of the pelvis. That yellowish color right there is cartilage. So there's actually a piece of cartilage between the two halves of the pelvis, which we call the pubic symphysis. We see this in the spine as well. There's all of these yellowish discs right there. Those are called the intervertebral discs, or the cartilage discs between each of the vertebrae. And that just makes your spine a little bit more flexible, and this makes your pelvis a little bit more flexible. Now the bones of the leg, we'll start with this, the femur, which is the longest bone of the body. The proximal end of the femur connects to the pelvis, and the distal end of the femur, this little bone called the patella, or your kneecap. And the patella can actually slide from here down over your knee as you bend it. Mortimer, you're so flexible. Look at that range of motion. We have two bones in the lower leg. Here we have the tibia, which is going to be the bigger of the two bones. That's also your shin bone. So if you ever bang your shin on something, you're hitting your tibia right here. And there's not a lot of cushion between your tibia and the skin over your shin. It's not like the back of your leg where you got your big calf muscle there for cushion. That's why your shin is so vulnerable to painful collisions. So you can feel your tibia. Your fibula, though, which is sort of surrounded by muscles on all sides, you can't really feel that one as easily. But this is the fibula right here. So tibia is the big bone, fibula is the smaller bone. Whoa, cool ankle bracelet. Now in the foot itself, we have your heel bone called the calcaneus. Wave with your foot. The rest of the bones of the foot kind of mirror the bones of the hand. Instead of the carpals, we have the tarsal bones. So the tarsal bones are all here, and then down here we have the calcaneus. And if we have tarsals, then we have metatarsals. Calcaneus, tarsals, metatarsals. And finally, the bones of your toes are also called phalanges. Easy enough to remember. So go ahead and take a moment, wiggle all of your phalanges, your fingers and your toes, phalanges. All right, let's go ahead and review all the bones of the leg again. We have the pelvis here and the pubic symphysis in between the two halves of the pelvis. We've got the femur, we've got the patella or kneecap, we've got the tibia, that's the bigger bone, the shin bone. We've got the fibula. You can also remember that the fibula is always on the side. I kind of remember it like it's got the word fib in it, like it's lying about who it is. It's like, yeah, I contribute a lot to the stability of the leg. When really the tibia is doing all the work, the fibula is sort of lying about its usefulness. That's probably not completely true. It probably is really important, but that's how I remember. Tibia versus fibula. The fibula, it's lying. It's not doing that much. It's the smaller one. And then we have the calcaneus or the heel bone. We've got the tarsals, the metatarsals, and the phalanges. All right, now Mortimer is going to provide us with the bones of the skeleton tour. Let's go. Here we have the skull, of course. We've got the frontal bone right there. We've got the parietal bones on the top there. We've got the occipital bone, and of course the temporal bone on the side. We've got the maxilla right there, and the mandible down there. And here's a view from the bottom. That's kind of cool looking. That big hole is where the spinal cord enters up into the brain. All right, you just chill right there for a second. I'll be right back. Okay, boss. Here we've got the sternum with the notch right there, and then this protrusion sticking out right there. We've got the costal cartilage, which connects from the sternum to the ribs. And of course, we have 5 true ribs, 5 false ribs, and in the back here we can see the 2 floating ribs that don't connect to anything. Spinning Mortimer around to the back, we've got cervical vertebrae up here, 8 of those, 12 thoracic vertebrae that are all connected to one of the ribs. The lumbar vertebrae, we've got the sacrum, and then the coccyx or the tailbone. Back to the front, we've got the clavicle, which connects from the sternum over to the scapula. And the scapula is kind of a strange shaped bone. It's kind of a V shape right here, so it's got this protrusion sticking out right there. That's your shoulder blade. It connects to the humerus. The humerus runs down here, where it connects to the radius and the ulna. Here's the radius on the thumb side. Here's the ulna on the pinky side. And then of course we have got the carpals, the metacarpals of the hand, and then the phalanges. Up here we've got the pelvis and the pubic symphysis, which is the cartilage between the two halves of the pelvis. We've got the femur, which runs all the way down here. Oop, apparently Mortimer's stand is broken. We've got the patella or the kneecap. We have the tibia, that's the big bone there. We've got the fibula, the small bone. Down over here we've got the calcaneus, that's the heel bone back there. We've got the tarsals, the metatarsals, and then finally the phalanges there at the bottom. All right, thanks for the tour, Mortimer. Oops. Thanks for the tour, Mortimer. No problem. Can you put my head back on now? No problem. You got it. All right, here's a blank version of our diagram. Take a moment, pause the video, and see if you can identify all of the bones in the diagram. All All right, here we have the skull, and of course the skull contains the frontal bone, parietal bone, occipital bone, temporal bone, maxilla, and mandible. We've got the vertebrae, which will include 8 cervical, 12 thoracic, 5 lumbar, and then the sacrum and the coccyx. We have the sternum, and we have the costal cartilage branching out of the sternum, which connect to the ribs. We've got 5 true ribs, 5 false ribs, and 2 floating ribs in the back. We have the pectoral girdle, which includes the clavicle, the scapula or shoulder blade, the humerus, the radius on the thumb side, the ulna on the pinky side, the carpals, metacarpals, and phalanges. And then all of the leg bones, we have the pelvis. The pubic symphysis is a piece of cartilage between the halves of the pelvis. The femur, the kneecap called the patella. We've got the tibia, fibula, calcaneus, tarsals, metatarsals, and the phalanges of the feet. And of course, all these bones down the center are called the axial skeleton, and all of the bones of the arms and the legs are called the appendicular skeleton.
Professor Dave here. Let's check out some joints. We just learned about all the bones in the human body, but if these are so hard, how is it that the human body is so flexible and bendy? Such variety of motion is made possible by things called joints. These are found where bones meet, so let's go through the structure and function of all the joints in our bodies. First of all, we can classify joints either by their structure or by their function. If by function, we are referring to the extent of mobility that is provided by the joint. Synarthroses are immovable. Amphiarthroses are slightly movable, and diarthroses are freely movable. These each serve their own particular purpose within the skeletal system. Then, if going by structure, we can discuss fibrous joints, which tend to be immovable, synovial joints, which tend to be freely movable, and cartilaginous joints, which exhibit a range of mobilities. Let's zoom in on each structural classification. First, with fibrous joints, there is a lot of dense fibrous connective tissue, and no joint cavity to speak of. These joints are for connecting bones that don't require a lot of movement. There are 3 types of fibrous joints. These are sutures, syndesmoses, and gomphoses. We talked about sutures when we looked at the skull, and this is the only place we will find them. They contain many interlocking fibers of connective tissue that are connected to the periosteum of each bone, allowing them to tightly interlock, and this tissue eventually turns into bone, or ossifies, so that by middle age, the skull bones are all fused together, at which point the sutures become synostoses. The next type of fibrous joint is syndesmoses. This is where bones are connected only by ligaments, which are bands of fibrous tissue. We see this connecting the radius and the ulna. Here the fibers are short, which prevents movement. And the last type of fibrous joint are gomphoses, which are like a peg-in-socket type of joint. This only occurs between a tooth and its alveolar socket, as the teeth are more or less embedded in these, and the ligament present is called periodontal ligament. Next, after fibrous joints, we have cartilaginous joints. Here, as one might guess, bones are connected by cartilage. These also lack a joint cavity and are not particularly movable. There are 2 types of cartilaginous joints. The first are synchondroses, which contain hyaline cartilage. Before, we mentioned the epiphyseal plate in long bones of children, which allow for bone growth, and that is an example of this type of joint. The first rib also has one of these between the costal cartilage and the manubrium of the sternum. The other type of cartilaginous joints are symphyses, and these are made of fibrocartilage. This is compressible, so these joints are meant to be shock absorbers. We can find these in between vertebrae and in the pelvis. Lastly, we have synovial joints. These are the ones that have an actual cavity filled with fluid, which allows for substantial mobility. Most joints are of this type, especially the ones in our limbs. The structure of these is more complicated, but let's note a few features. First, articular cartilage covers each opposing bone surface, protecting the ends of the bones. Then there is the joint cavity. This contains synovial fluid, which is very viscous, containing hyaluronic acid secreted by cells that are in the nearby synovial membrane. This fluid acts as a lubricant and reduces friction between the layers of cartilage. The synovial membrane, together with the fibrous layer that flanks it, comprise the articular capsule. And beyond that are some reinforcing ligaments, as well as nerves and blood vessels. Beyond this basic structure, some synovial joints have fatty pads or discs of fibrocartilage separating the articular surfaces. These are also known as menisci. Closely associated with synovial joints are often bursae, flattened fibrous sacs containing synovial fluid, as well as tendon sheaths, which are similar but much longer and wrap around a tendon. These serve to lubricate certain surfaces and reduce friction between adjacent structures. Now that we know about the types of joints and their structural features, let's learn about the terminology that refers to the types of motion they allow. Muscles, which we will discuss next, have an origin attached to an immovable bone and an insertion attached to a movable bone. When muscles contract around joints, we get movement, and we can describe this motion by referencing certain lines or axes, as well as certain planes of space. First, for synovial joints, there can be non-axial movement, which are slipping movements, uniaxial movement, which happens in one plane, biaxial movement, which happens in two planes, and multiaxial movement, which happens in all three planes of three-dimensional space. Beyond this, motion can be gliding, angular, or rotation. Gliding movement happens when one flat bone surface slips over another. This happens at the intercarpal and intertarsal joints, allowing for left and right wrist motion. Angular movement happens when the angle between two bones changes. An example of this is flexion, which decreases the angle of the joint, like when bending the head forward, or bending forward at the waist. The opposite of this is extension, which increases the angle of the joint. Straightening your neck or elbow or knee will achieve this. And hyperextension goes beyond this, like when bending your head back, bending backwards at the waist, and so forth. Then there is abduction. This is motion of a limb away from the midline plate of the body, such as moving your arms up and away from your sides. Adduction is the opposite, moving a limb toward the midline plate of the body, like bringing your arms down to your sides. Circumduction involves making circles with a limb, such as arm circles. And lastly, rotation involves the turning of a bone around its own axis. This happens at hips and shoulders, and it can be categorized as either internal rotation or external rotation. Beyond this are some special movements that don't fit into these categories, like supination and pronation, which has to do with the radius moving around the ulna in the forearm, dorsiflexion and plantar flexion in the foot, as well as protraction and retraction of the mandible, among others. There is much more we could say about each individual joint, but since we have the basics covered, that completes our introduction to the skeletal system.